I'm Dr. David Schneider. I'm a family physician and chair of family and community medicine at St. Louis University, and have been involved with the Academy on Violence and Abuse now since its inception almost 7 years ago. And we're really thrilled to be bringing you our first faculty development workshop. We've been wanting to, this has been part of our vision for a number of years, and have been working hard for the last couple of years putting this together. And hopefully you guys will really enjoy and get a lot out of this afternoon's workshop. I've been asked to remind everybody to turn your cell phones onto silence if they aren't already. And I'm going to ask the rest of the presenters in the workshop today to go ahead and introduce yourselves.
Oh, me?
Yeah.
Oh. I'm just wondering if, because of our videographer, if we should just come up there and stand next to you for a minute and introduce ourselves?
Yeah, that's probably a good idea.
We don't need a mic, I don't think.
Well, you do because this is being recorded. Let me also tell you, we're recording today's workshop because one of the ways we want to deliver the material is through a webinar or online learning modules. And so we may take snippets of today's workshop and incorporate it into kind of a multimedia format to reproduce the workshop in the future. So let me go ahead and okay. That's fine. We'll see if that works.
All right, I'm going to come up here and talk into Dave's tie. I'm Dr. Candace Burton. I'm an assistant professor of nursing at the Virginia Commonwealth School of Nursing in Richmond, Virginia. And I have also been with AVA pretty much since it started, on and off as a student member, as a doctoral student, and now as a full-fledged faculty member in an institution on my own. So I'm very excited to be part of this workshop. I've been working with Dave on this for the better part of a year, so we're really excited to have you all here today.
Yeah, I believe, Candace, you were the first student member we had. Yes.
I'm Kathy Franchuk, and I'm an assistant professor at the University of Utah School of Medicine, Department of Pediatrics. And I've been with the AVA now probably close to 2 years, so I'm kind of a newer member here. But I really am grateful to be on in this group and on this workshop, and I look forward to hearing all of your discussions.
I'm Chris Campbell, and I'm also an assistant professor in pediatrics at the University of Utah. And I am a member for less than a year, but I also look forward to hearing what people say, and I'm someone who I'm a junior faculty member in clinical research, so that's the perspective I'm coming from.
I'm Bea Yorker, and I'm a full professor at Cal State Los Angeles, which is a comprehensive university. I also bring the perspective of being a dean of a College of Health and Human Services, and writing promotion tenure reviews, and doing, I have a law degree, so I do more qualitative and descriptive research.
Great. Maggie?
And I'm Aggie Tiwari. I'm Associate Professor of Nursing at the University of Hong Kong, also the Assistant Dean at the Faculty of Medicine, also University of Hong Kong. And I've been involved with this faculty development for a couple of years now.
Yeah, since we started.
And I think every time when we have the teleconference, I got everybody up about 3 o'clock in the morning. So
Not that bad. We were able to find a reasonable time. If we do the teleconferences at 8:30 in the morning, I think that's about 8:30 at night, your time, right?
not quite. Well, beyond
Something like
but
that, yeah.
It's good, yes.
Yeah, great. I want to get an idea of what fields everybody's from. And actually, it looks like we've got about who are participants in the workshop that aren't on AVA's board or presenting today. So I thought we could just quickly go around the room and say who we are. And what I will do is give the recording mic to pass around. If I can untangle it. That probably wouldn't be too effective. This is the recording mic, right? Good.
No, do you want to start?
Who you are and what you do in your day job.
Hello, I'm Colleen Friend, and I'm from Cal State LA. And in my day job, I'm the director of the Child Abuse and Family Violence Institute. My discipline is social work. I see a lot of familiar faces. And I actually practice in a department of communication disorders because, as we all know, children with communication disorders are high risk for abuse and neglect. So I'd like to introduce Vasavi. So I'd like Vasavi to say something about yourself.
Thank you, Dr. Friend. My name is Vasavi Charatram. I'm from India. I'm a master's in counseling student in Cal State LA. That's my day job. My evening job is I work as a graduate teaching assistant for Dr. Colleen Friend. That's my area of interest, child sexual abuse, and I want to work in rehabilitating children who are victims of human trafficking from the ages of 4 to 11 as a future career. Thank you.
Yeah, you should.
Hi, I'm Tasneem Ismailji. I am the incoming president of AVA. And a pediatrician.
Hi, I'm Alex Sohal. I'm from London in England. I'm a clinical lecturer in primary care at Barts and London Medical School. My research interest has been about identifying domestic violence in primary care. My mentor's Professor Jean Fader, and I do that half the time, and the other half the time I'm a general practitioner, which I think you call primary care physicians in the US, in a practice in inner city London.
My name is Brooks Keeshan. I'm a pediatrician and child psychiatrist, and I'm currently a fellow in child abuse pediatrics at Cincinnati Children's Hospital. And I'm also I'm the trainee board member of the AVA, as well. So.
I'm Bruce Ettinger. I'm an OBGYN by training. Currently work in Los Angeles in the Licensing and Certification Division of LA County Department of Public Health. We do the enforcement of the various healthcare regulations for state licensing and Medicare certification. That's my day job. In my night job, I've been working with the American College of OBGYN on violence and abuse, and that's how I got to be one of the board members of our current AVA. And I'm glad you're all here.
I'm Marian Donahoe, and I am from the University of Tennessee Health Science Center, College of Nursing, Public Health Option Group. And by trade, I'm a pediatric nurse practitioner, and my research is in changing pediatric provider practice so that questions of violence are asked of the children, not of the parents.
So I'm Peter Kronholm. I'm also a AVA board member, and my day job, I'm a family physician at the University of Pennsylvania, assistant professor. Come up for promotion in a year and a half, so an important workshop for me. And my research interests are around primary prevention strategies in primary care settings.
My name is Paula Johns. I'm one of the locals here from Minneapolis. I am working on my master's in nursing at Augsburg College here in the Twin Cities. I work as a sexual assault nurse examiner for 2 hospitals here in the Twin Cities. I'm also working half-time as a nurse at the women's prison in Shakopee.
Well, mine's going to sound kind of boring, but my name is Annalie Balk. I am a plant nurse at a medical manufacturing plant out in Chaska, Minnesota. So I have 800 employees, and I take care of all the FMLA, disability, work comp, return to work, wellness, and the owners of this company, the Flyshackers, are big sponsors from Ridgeview Medical, which I used to work at for a number of years, and I used to work with Dr. McCullum in the emergency room a number of years ago. Great guy.
Ridgeview Medical was one of our initial sponsors of ABA going back when we started in 2004.
So we're just telling our name and where we're from. Krista Kotz. I'm in the Bay Area in San Francisco. I'm program director for the Family Violence Prevention Program at Kaiser Permanente, Northern California.
What an interesting group of people we have here. My name is Dave Corwin. I'm from Salt Lake City, Utah, University of Utah, where I'm the medical director of Primary Children's Center for Safe and Healthy Families, which is the child abuse program, and chief of child protection and family health for the Department of Pediatrics. And I am the incoming president-elect in training.
You need a lot of training too, yeah. Good afternoon, welcome everybody. My name is Bob Block. I'm the current president for one more day of the Academy on Violence and Abuse, and then I'll be riding off into the sunset, but still being involved with this academy, while I'm also the president-elect of another academy, the American Academy of Pediatrics, and I'll be trying to take our messages from that we're all interested in this meeting and merging them with the interests of pediatricians across the country through the other academy.
I'm Martina Jelly. I'm faculty in general internal medicine at the University of Oklahoma in Tulsa, where Bob is from. And I do some teaching with medical students and residents on intimate partner violence. And I've just started to research the connection between health effects of violence and chronic pain.
Hi, I'm Deb Loxton. I'm from the University of Newcastle in Australia, which is in New South Wales. Newcastle, not Newcastle in England. And I am the Deputy Director of the Australian Longitudinal Study on Women's Health. My interests are in the health impacts of intimate partner violence, and I've just started having a look at abuse in older age using data that we've collected from the longitudinal study. I have a background in psychology, but mostly I work in public health these days.
Diane Shadowald. I'm on faculty at the University of Minnesota. I teach at in the Family Nurse Practitioner program. I work in the primary care clinic at the U and interested in women and violence and prevention.
Good afternoon. I'm Pat Speck from the University of Tennessee Health Science Center in Memphis, Tennessee. I'm a family nurse practitioner who worked in public health, who stumbled into sexual assault, domestic violence, and all the issues that we work on today back in the early 80s. And when forensic nursing became a word, I rode the wave in and have been the president of the International Association of Forensic Nurses. I also went back and got a doctorate in public health nursing, and now am the public health nursing option coordinator, which the name will change July to option director. I hope there's a raise with it. I'm also the chair-elect to the Family Violence Forum at APHA, and we are in the process of becoming a caucus and would like to invite Ava to be a member of the caucus and any others members. I have just invited your president-elect to come to be on the panel to look at the systems approaches that we're going to have in place in order to educate the individuals to take care of the individuals. I'm very happy to be here because every year I've had a conflict with another organization, and I am NIJ funded, not NIH funded. Thank you.
My name is Mary Lou Mylant, and I'm from Rapid City, South Dakota. I teach professor there for the College of Nursing in primarily psychiatric nursing. I'm a psych mental health nurse practitioner, but work mainly with kids and adolescents. And most recently, the research has been with American Indian teen parents and younger kids, and looking at trauma and abuse and the relationship to that and substance abuse. There you go, Joe. I hate being last.
Hi, I'm Joan Van Isle. I'm from the Twin City area. I'm a mother, author, advocate. I wrote a personal memoir about my own journey growing up in a very abusive home. I am the voice for the voiceless. I created a business called Hearts of Healing to help people reconnect with their soul purpose. And the school I went to was a school of life. And I'm paying attention to what all you guys are doing on behalf of the abuse victims. So thank you.
And I'm Charles Mouton, the last person before your workshop. I am the Senior Vice President for Health Affairs and Dean School of Medicine at Meharry Medical College in Nashville, Tennessee. And I worked in late life domestic violence.
And Charles is also a family physician who worked with me on the faculty at the University of Texas Health Science Center for a number of years before he moved to Washington to move over to Howard, and I went to St. Louis to work at St. Louis University, both as chairs of family medicine.